This one's for all of my cycle breakers and trauma survivors. Big T or little t, we've got you covered. Bonjour and welcome back to Blumera Podcast. I'm your host, Bree, and today I'm joined by Dr. Shahrzad Jalali. Her and I shared a conversation about silent trauma, emotional autonomy, and breaking cycles. We talked about how trauma is stored in the body and the ways that it can show up in our relationships. I've become all too familiar with some of the ways that trauma can be stored in the body, as I'm sure you've heard if you're a regular listener. And if you're new here, hello. I hope you stay a while because Dr. Jalali helps us better understand generational cycles of trauma and the roles that we sometimes just fall into in our families. And we're not just going to talk about the hard stuff without also talking about the healing. We're not going to leave you hanging like that. So let's get right into the call. My first question I have for you is, what exactly is silent trauma and how does it differ from more overt forms of trauma?
That's a great question. Being a psychologist, one of the things that I usually ask people in the beginning of my treatment with them is, would you say you've had any kind of trauma? And over the years, I've come to the realization that most people, I don't know if that question makes them feel uncomfortable or sometimes offended. They're like, no, I had a pretty normal life. And in my head, I'm thinking that does not mean you have not had trauma. To the average person, I think trauma is a life-changing event or something that has significantly impacted them, whether it was a huge accident or a loss or something that left them with visible scars, whether physical or emotional. In the realm of psychology, trauma or silent trauma, I should say, is something that has happened throughout your life that was not necessarily significant enough outwardly for you to deem it as traumatic, but has left its trace on your psyche. Now, this could be as kind of silent as a belief system. So let's say I was a child, I grew up in a household that there was not a lot of room for big emotions. So every time I expressed myself with big emotions, it was not received well. As a child at that point, I learned that it is not okay for me to have these emotions, or at least to display them. And that by itself is a very traumatic experience because it changes who I am and how I show up in life on a daily basis. So I would say that's my explanation of silent trauma.
It's a great one. Why is it so difficult for people to recognize their own silent trauma? I know you kind of mentioned that they'll skip over it or think that they had a pretty normal life. Why do you think it's so difficult for people to recognize that?
Because silent traumas usually happened in very primitive stages of life when we're very young. And by the time we kind of come to know ourselves as who we are, we pretty much have formed what we know as our personality. And we can't identify what this was rooted in. Now, what do I mean by that? Let's say I was the middle child in the birth order. And let's say I kind of competed with the baby and the older child for attention. And this has left its trace on my personality in many shapes and forms. But as a 10-year-old, I don't necessarily deem this as traumatic. I don't even know that this is my dynamic because this is all I have ever known, right? So it gets so intertwined into who you are as a human that at least to you, it's not recognizable. Maybe on an unconscious level or subconscious level, it is. So it will show up in your fantasies or dreams, or essentially you should see things like behaviors that allude to it, but you're not necessarily able to identify it.
That makes sense. How does silent trauma shape our beliefs, behaviors, or relationships without us even realizing it? I know you kind of answered this, but would you give a different answer for that?
I would say it's pretty much rooted in what I just said. We go through a traumatic event. It reshapes how we view ourselves, other people, and the world. And from that point forward, that becomes our dominating belief. We are all born, our psyche, in a very intact manner. As we go through life, we become fragmented. These fragmentations are the silent traumas we're referring to.
I can relate to that and how it can shift your psyche and beliefs moving forward.
Correct.
How does silent trauma get passed down through generations, even if nobody is talking about it?
So this happens in two different ways. You know, that whole debate of nature or nurture, essentially. When one of your parental figures has gone through something traumatic and they've never identified it or responded to it or worked on it, essentially that creates a lot of different negative behaviors in them. For example, they may be angry, they may be anxious, they may be depressed. So, first and foremost, you are being raised by a caregiver who's displaying those behaviors. And those behaviors can definitely impact how you're being raised and who you're becoming, essentially. It's very different to be raised by a parent who's very present and that does well emotionally versus one that has emotional dysregulation that you have to deal with on a daily basis. On a more, I would say, from a more genetic component of it, epigenetics, when trauma continues to remain in a series of basically people's life events. It goes from one generation to the next, unless one generation stops and does something different. And epigenetics, it's a fairly new branch of science, but very interesting in the sense that we come to notice when a gene gets corrected, the next generation actually inherits the corrected gene, not the faulty one. So it's actually very fascinating.
That is. I've researched a little bit. Obviously, I'm not a doctor, but I've researched the epigenetics. And as a cycle breaker, that's so comforting to know and hear and to be able to actually see in research.
Absolutely. I always tell my patients the best, most important gift you can give to your children is to do your inner work yourself. Because, you kind of leave them with people who are more present, who are more able to truly respond versus react to a phenomenon, which is a wonderful way to be raised.
I agree. What are some signs that someone is carrying silent trauma, even if they don't consciously remember experiencing anything traumatic?
I would say go to your daily felt sense. A lot of people kind of report, nothing in particular is wrong in my life, but I don't feel good. It's as if something is missing. I feel an emptiness. Sometimes people have mood disorders, things like depression, anxiety. Sometimes people have relational issues, like they report that I don't really get along well with people, or I can't really keep friends for a long time, or, I have issues in my romantic relationships all the time. All of these are usually somehow rooted in, I'm not saying they're necessarily the byproduct of trauma, but if you kind of peel layers off of them, potentially you will find its roots, at least in a belief system that has somehow come to be shaped by something that was not a good experience for the person, even if we don't want to call it trauma.
How can someone begin to uncover and kind of peel that back and name the silent trauma that has been shaping their life?
The first step is to identify what's happening with you. So if I can admit to myself that this does not feel good to me, that would be the first step. And then from there on, I'm usually going to do something about it, whether start educating myself more or building my awareness or getting the help of an expert. But the first step is actually admitting to yourself.
What does emotional autonomy mean, and why is it essential for healing from trauma?
So, people who have emotional autonomy are essentially responsible for their own emotional experiences. Let's say you and I are friends and you do something to hurt my feelings. If I don't have emotional autonomy, it's all about what you have done to hurt me. If I have emotional autonomy, I can sit down with you and say, when you did this, it hurt my feelings. In that sense, I am taking responsibility for my own emotions and not just dumping it on you as a person who has hurt me.
I'm curious what the difference is between emotional autonomy and like avoidance or hyper independence.
So people who have emotional autonomy don't avoid things and are not dependent on other people. Why? Because they take control of their emotional state, whatever that means. They identify it, they try to find a solution for it, and they address things. People who don't have emotional autonomy usually resort to the things you mentioned in order to regulate themselves because they don't have the ability to take control of the situation emotionally.
What about hyper independence?
All of them. These
Oh,
are all symptoms or behaviors of people who do not have emotional autonomy. Now, depending on your typology, you're going to gravitate towards one of these things. Like if you have more of an independent typology, you're probably going to avoid and blame. If you have more of a dependent typology, you're probably going to be super needy and stick to someone and need validation from them all the time and so forth.
how do you navigate guilt when stepping into emotional autonomy, especially if you come from a family that suppresses emotions?
So there are two emotions that are talked about a lot in psychology. One is guilt, the other is shame. The way I conceptualize them, and keep in mind, people may have very different ways of looking at this. One of them is more productive than the other. In my opinion, guilt is more productive than shame. Because shame means I am wrong, I am bad. Guilt means I have done something wrong or I have done something bad, right? In one, you become something, in one, you have done something, right? So, in my opinion, shame is very destructive in nature because once you identify with being bad, it's very hard to sidestep that. Guilt, on the other hand, can be very constructive in nature because once you identify a behavior, a dynamic is negative, you can sidestep it. So it's very powerful, essentially. It may have a bad rep in everyday life, but from a psychological perspective, I think the moment I have guilt about something, like let's say I drink a lot, right? The moment I drink, oh, I'm drinking a lot. This is a good thing because, and I feel guilty about it. My psyche is telling me you need to stop drinking this much. So if I were to respond to it in a productive manner, this is actually helping me, not working against me.
That's a good reframe. How does cultivating emotional autonomy help people build more secure, fulfilling relationships?
See, the mark of a good relationship, when we say relationship, we're talking about more than one person, right? Is that they can each independently handle their own emotional states. Because when two people come together, they will trigger each other. It's impossible. I don't care who these two people are, for two people to meet in life and go through a process together. And at some point, not get on each other's nerves, trigger each other, frustrate each other, irritate each other. It's inevitable. Now, if I have emotional autonomy, I can kind of go into my own inner space and say, identify whatever it is that I need. I need a moment. I need to speak my frustration. I need an apology. I need to voice how this situation is bothering me. When I don't have emotional autonomy, I resort to one of the things you mentioned earlier. I don't talk, I avoid, I distance, and a bunch of other things that may happen in the process.
What are some daily practices that listeners can do to strengthen emotional autonomy?
That's a great question. I would say the first step is to start identifying your emotions because so much happens in our head, during just one day. So many different emotions visit us. And because we all live very busy lives, we don't have time to stop and say, what am I feeling right now? In fact, to tell you the truth, you'd be surprised to know most people who come to my practice are very, very, very functional individuals because I do a lot of analytical work. So they're usually people who are very aware of their emotions, potentially have done years and years of therapy. But even then, they have a lot of difficulty articulating what they're feeling. They even have difficulty identifying it. So the way we survive our emotions is we suppress them. So we notice these things coming up and then we distract ourselves. We have a drink, we call someone, we go for a run. Some of the things we use are more functional than others, but throughout the day, we're continuously kind of just shoving down a bunch of emotions that we don't feel comfortable feeling. So to start, we need to maybe journal, maybe just create a few spaces spaces throughout the day, even if they're 2, 3 minute slots of time, to just sit down and reflect. What am I feeling? How do I know I'm feeling this? Where am I feeling it in the body? How is it showing up? Is it tension? Is it pain? Is it a knot in my shoulder? Is my stomach upset? And then learning to connect the dots as you go forward.
That's a great practice. How does trauma get stored in the body, and why does it linger even when we try to move on?
So, all of the new research actually shows that trauma gets stored in the body and not so much in the psyche, the way we feel like a memory can be traumatic for us. The reason for that is our nervous system. So, essentially, let's say I've gone through a car accident, my nervous system in that moment has learned to become hyper vigilant regarding accidents or trauma or anything else associated with it. So every time I hear a loud noise or I have a near accident or something feels threatening to me, my body will have the same response to that phenomena as it did to the actual horrific car accident. Whereas most of the time, this is not merited, right? But the body remembers the impact as such, reacts to it. And there is a reason for it. I mean, we're not crazy. Our body does this in order to preserve itself, right? So the wisdom behind it is protection. But essentially, we don't need that level of protection because not every mere accident is going to end up the way that traumatic accident ended up. So we have to learn to kind of identify these responses, regulate our nervous system repeatedly to go back to our original response versus the reactory response that's trauma rooted.
Can you speak a little bit more about somatic healing and how it can help release stored trauma?
Absolutely. So I am a big fan of somatic work. It's rooted in Peter Levine's work, if you're familiar with him. And he speaks a lot about how during a traumatic experience, what happens is the body doesn't get to finish the cycle of the emotion because it gets interrupted. And that interruption is what causes hypervigilance in our body. So every time we come across a triggering event, our body goes back to that state of hypervigilance because it has the need, the desire to go ahead and finish that cycle of emotion. Now, if we can tolerate the discomfort long enough for that to naturally happen, we will heal from that experience and eventually move on. And keep in mind, healing is a process. It's never a perfect kind of like when you go through something physically traumatic, you always have a scar. Emotionally, you continue to carry that to some extent as well. But you'll get rid of that tension, you'll get rid of that trauma response essentially. So in somatic work, the practitioner kind of offers you support to let your body finish those interrupted cycles of emotion so you can kind of start the process of healing step by step.
What are some ways to ground yourself when trauma memories show up physically, such as tension, shaking, or panic attacks?
I would say the best way, most quick way is through the five senses. So start with your eyesight. If you can, just look around the room, pick a few things, start describing them to yourself in as much detail as possible. Touch something. If you can't find anything else, just touch whatever clothing items you're wearing or any surface that you can find. If you have access to any food or any piece of candy or something that you can put in your mouth and kind of just allow it to sit there for a little bit, noticing the taste to some extent. Hearing is very powerful. There's a lot of bilateral tunes that you can find on YouTube or anywhere else and kind of just listen to them with headphones. If you can't access anything like that, just listen to the sounds and noises and voices around you. The fastest acting one is actually smell, because smell doesn't go through the relay station of thalamus, so it gets immediately processed by the brain. So if you're a type of person that has a lot of emotional dysregulation, my suggestion is carrying some form of lavender or essences with you that you can go to very quickly. I usually have one in my car, one in my office drawer, one in my bedroom, so that way if I'm feeling dysregulated, I can just use them very quickly.
That's such a great tip. I'm a sucker for lavender, like lavender everything. And I might have to start carrying some in the car and places 'cause I have it at home and I can go get it, but I also have toddlers, so it's like I can't always leave in the moment or
Leave.
it's not easily accessible or I'm in the car and it's not with me.
I hear you.
What should someone expect emotionally when they start working on releasing stored trauma?
That's a tough one. Construction always happens after destruction. So when I say this, maybe I'm exaggerating to some extent, but it always feels worse before it feels better. You just have to be able to tolerate the discomfort for a while because these are a lot of things that we protected ourselves from. So we haven't really felt them. We feel them, but we don't feel them essentially, right? And what happens when we start working on them is we start feeling them more deeply, and that's painful. That's why we need a guide because left at our own device, we'll resort back to not feeling them again.
How does healing that stored trauma change how we experience emotions, relationships, and our own self-worth?
It changes the way we show up in life. I've actually depicted this really well in a book I've written that is scheduled to come out in this fall. The book is called The Fire Within Us. And what it does is it takes you through a process of a person who is living with trauma and responding to the trauma, but is uber functional. So no one really understands how this person is feeling this trauma, or they themselves don't even necessarily recognize it. But they make decisions based on the trauma. Like they get into relationships that resonate with the trauma and so forth. So continuously getting hurt over and over and over again. And eventually, when they can connect the dots, they are no longer attracted to that dynamic. Not that they forcefully make themselves not do that. That option is no longer attractive to them. So it kind of shifts the way you show up in life. It's as if you shed skin and you grow a new one.
Can't go back into the old one. I think about snakes outgrowing the skin. They wanted to try to fit back into it. It just wouldn't fit for them anymore.
Absolutely. That's a great indication.
If someone is listening and realizing that maybe they have some stored trauma in their body, what is the first step that they should take?
Well, this is a hard process to initiate. So I just want to acknowledge that if you're going through something like this and you feel stuck and you don't know what to do and you feel like nothing is going to be able to help you, it's very normal to feel that way. Take one step today. Maybe that one step for you today is calling someone up. Maybe it's admitting to yourself that you need help. Maybe it's picking up a podcast, a book, I don't know, anything that can inform you about the matter. But break it into tiny steps you're able to take, and then eventually you'll find your path with it.
Why do so many trauma survivors develop that compulsion to perform, achieve, or prove their worth?
See, when you go through trauma, one of the main things that happen is you feel like you're not going to be okay. And what do people who think they're not okay do? They want to do everything in their power to be okay. So they're willing to go that extra mile to kind of show up and perform perfectly so nothing bad can happen. It's a false belief system that if I just show up and go the extra mile, I'm going to control the situation.
How can somebody recognize if they are caught in that trauma-driven cycle of overachieving? I know for myself, I just think I'm doing a really, really, really good job. And it's hard to see the negative side of it.
Check your intention. I think we can lie to everyone, but we can't lie to ourselves. If something is feeling good and kind of just resonates with you and is calling you and it generates more energy within you and it fulfills you, do it. If you're doing it to be recognized, to be validated, to be seen, to be kind of, appreciated for that dynamic, but it's giving you fatigue, it's causing you to feel distress, it's putting extra stress on you, then you're doing it for the wrong reasons.
I'm glad that you brought up seeking validation. What are the dangers of seeking validation through work, success, or people pleasing?
The danger is the day that it's not there anymore, and it will come for all of us. None of us will always be on the spotlight all the time. It will destroy you.
How can we begin to untangle our self-worth from our productivity?
We have to tap into our true self. So, whenever our self worth is tied to our productivity, that means we're operating with our false self, a mask that we've created to survive in the world and to be liked. Now, if I have the courage to be who I am truly, maybe I won't be liked as much because maybe now I say no to more people than I did before. So, I'm going to disappoint a lot of people, and that's not going to feel good. I may lose friends. It takes a lot of courage to actually behave that way in life, right? So we have to operate with our true self versus the false self we've adapted to be liked more.
How can someone begin to embrace rest, stillness, and joy without feeling guilty or unproductive?
You have to be present in the moment. We usually think of these things as not doing anything or wasting our time. Or see, I come from the Eastern world. The Eastern world makes a lot of room for being. Being is just as much appreciated as doing. Whereas in the Western world, we are very much focusing on doing. But for doing to actually happen well, it has to come after being because creativity starts to emerge in being. Kind of like the seasons, right? If we were to always have one season, nothing will grow. I mean, growth happens after a dead season, essentially. And the psyche is that way too. They're both essential to our productivity. People who want to bypass being are usually not good producers, despite what they believe.
Oh, that's amazing. Oh, it was so wonderful meeting you. And thank you for taking the time to talk about all of these things. I know these topics resonate with my listeners, they resonate with me, and I'm excited to carry more healing and wisdom to them.
Thank you for the work you do. It's very meaningful.
If you've listened this far, comment something that you learned from either Dr. Jalali or myself in this episode, or let me know what you want to hear about next. Your voice matters here and helps shape future content. And if you want to hear more about healing your inner child, breaking generational cycles of trauma, or expressing your anger or emotions, click on the podcast title on whatever device you're listening on and scroll back to find more videos. I have been talking about this for years, and I don't plan on stopping anytime soon, so make sure you hit subscribe so you don't miss out on any of it. As always, I am so grateful to have you here with us today. I'll see you in the next episode.